Jamie, please describe your role for Dell.
I'm the worldwide general manager and vice president of the Healthcare and Life Sciences division. It's the largest healthcare IT services company in the world. We have about 13,000 people that get up every morning and think about healthcare.
So how relevant is healthcare as a sector for Dell in general terms?
So when I joined Dell 5 years ago, we were primarily a hardware company. Over the last 5 years, through a set of acquisitions, we've become the leading services provider in the whole healthcare industry, and it's extremely relevant. In our services business, the company that we bought that kind of brought us this relevance was Pro Systems. Pro Systems services business was about 70% healthcare. So, it's a very relevant part of what we do. Our business is over 50% services now. We are the biggest integrator in the healthcare industry. So, and we think about things every day about how to solve the business problems of our healthcare customers.
What are the specific challenges of that sector regarding IT?
I'll talk about the general problems, and I'll talk about how IT can play there. So I'd say, if you look at the major problems in healthcare right now, especially from a healthcare IT standpoint, you have, adoption of electronic medical records. In the U.S., for instance, about 50 or 60% of hospitals have some kind of electronic medical record, but physicians are about 15%. In the UK, it's actually the opposite. They have huge number of physicians, like almost every physician has an EMR, but none of the hospitals do. If you don't have access to patient data in a format that you can actually use at the point of patient care, in an electronic format, then you really can't make good clinical decisions. And the problem that's happening now in healthcare is that there's this huge proliferation of data. If you take areas like new modalities in medical imaging, you take things like digital pathology, you take areas like genomics and proteomics, it's a huge amount of data that a physician's having to deal with, and they only have 8 to 10 minutes with a patient. So you have to find a way to get the data in front of them in a format that they can use to really make good clinical decisions at the right cost point.
So what's the right approach for IT with regard to that?
So I think, we have to kind of approach these things, and we've talked a little bit to you in the past about some of our solutions. So I think, one of the ways you have to do is you have to make sure that, physicians don't sit still all day. So you have to make ways that you can deliver the data in a mobile environment. So it doesn't matter what the endpoint device is, you want to deliver the data in a secure and safe way to the endpoint. And so we have an offering called mobile clinical computing. A doctor can walk through a hospital, badge into any device that's there, and move the session with them as they go. And the session comes up in exactly the same place it was before. It saves an enormous amount of time. It goes from, minutes to authenticate to the system and to their app to seconds, and saves them an enormous amount of time and really drives better clinical care. If you look at areas like Unified Clinical Archive right now, which is a solution that we've built around medical imaging, currently right now one of the challenges in the industry is that once a person decides on what PACS system they're going to be using inside of a hospital, they kind of have vendor lockdown because, it's very difficult to migrate the data from one PACS to another. So, we have large customers in the U.S. and in Europe that have, petabytes of medical imaging data, and you want to be able to put it one place and never have to move the data again and be able to access the data no matter where you are. And that's what UCA allows a customer to do. So it writes it in a vendor-neutral format, and you can access the data from wherever you are in the cloud, from the cloud into any kind of archive system or any kind of PACS system. And it allows you to be able to unlock the data and really build an open systems environment for this.
Please describe the current Pediatric Oncology program based on cloud technology.
So Dell gives 1% of their pre-tax earnings to charitable organizations every year. We have a bunch of programs that we do in this space. One in the education industry, which is called Youth Connect, where we give electronic classrooms to schools all over the world to help increase, performance in education industry. We have a entrepreneurship program where students submit proposals, business plans around sustainability, environmental science to really change the world, from a sustainability standpoint. And we fund those programs, and then they go off and do the projects. And then the last program that we just announced 2 weeks ago is a program in Pediatric Oncology. And the exciting thing about this program is there's really a convergence happening right now between molecular biology and IT, with next generation sequencing technology and high performance computing. So the Human Genome Project took 10 years and cost $3 billion. Now Now we can do the same work of doing somebody's genome in less than 2 weeks for $10,000. So you actually make this a very clinically relevant thing because you can actually make a clinical decision based on a 2-week test, especially for oncology patients. So there's a very bad form of cancer called pediatric neuroblastoma. About 98% of the children that get this disease die within 1 year. And we have developed a program to run the first clinical trial for pediatric neuroblastoma that's a personalized medicine trial, which essentially targets the tumor in the patient and uses a cloud-based genomic sequencing analysis platform that allows you to be able to take this from months and years to weeks. And it's about an 8 teraflop supercomputer that's 1,200% faster than the current technology that the center had. It's a consortium of 12 cancer centers in the U.S. First round of the trial is 16 patients, and we're going to expand it globally to around 200 patients globally. We'll be running this clinical trial. And the idea is, we figure out what pathways are being illuminated by in the genome sequence, then we target drugs to those pathways. And we think in the first round we'll get up to 30 and 40% remission rates in the patients. So a very big jump in technology, really the merger of molecular biology, clinical medicine, and information technology really having a major effect on cancer research globally.
What, in your opinion, are the future challenges and opportunities in healthcare, and how can IT help to meet them?
If you look at the overall healthcare industry, the big challenges are delivering lower cost healthcare with higher quality outcomes. And that's all about data, right? You know that, people go to medical school and learn. Somebody comes in their office, they present some kind of condition, they have some kind of symptoms, and they say, I remember from med school right now. They say, I remember from med school, this is the disease that you have, therefore these are the drugs we should give you. That's pretty much how it happens now. The future of medicine is, you're going to have genomic data, you're going to have imaging data, and the physician is going to have to make a very quick decision. So it's a deluge of data they have to deal with, and they have to make a decision with most patients in 10 minutes. It's really how it is. They spend 8 to 10 minutes with patients globally. That's the average that a clinician spends with a patient. So they have a huge amount of data they have to get through and really make decisions. And the future of medicine is, being able to bring this data into a format and use decision support tools that allow them to be able to make good clinical decisions and make the best clinical decision that's the lowest cost clinical decision too. Information technology is absolutely critical in that, and that's really the play that I think that Dell has as a company overall, is to be the largest integrator in the healthcare space, is really to drive cost and drive up quality as we go forward.
What is the role of medical informatics at Dell?
Yeah, so I think the biggest problem that we have right now in the whole industry overall, and if you look at healthcare as an industry, most of healthcare is local. If you look at an average patient, my wife has multiple sclerosis, and she gets 95% of her care within 30 miles of our house, right? She has a set of 20 doctors that she goes to. Being able to use integration tools that allow you to integrate the primary care physician and specialist to the acute care center allows you to have access to all the data around the patient. This allows a physician to be able to use, analytics tools on top of it, which, Dell has available from lots of other partners, and be able to build these platforms that allow you to be able to make good clinical decisions. I'll give you an example of a customer that we've worked with in the past. It's Vanderbilt University Medical Center. They found, through some of their clinical research that as they put a customer on a ventilator inside of the ICU, if they didn't get them on IV antibiotics within 3 hours, they had an 80% greater rate of pneumonia for the patient, which is a really bad post-secondary effect. And what they use, they've used an informatics engine to start to look at. They built a dashboard for their nurses. In real time, it says yellow, red, green on it. So if they don't go and give the patient IV antibiotics within 3 hours, it beeps at them, tells them it's red. And these younger nurses who, have a little ADD and are used to video game type things, they've actually built it to look like a video game scoreboard, and they try and keep them in the green. And it's been a very effective tool for them, and they've lowered the incidence of pneumonia in their patients by about 75%. It's a huge way to show how informatics can be really used to really change the game in healthcare, and that's what we have to do across the board in healthcare.
What is Dell doing to bring the solutions to the German market?
If you look at what we're doing as a company right now, we're in the middle of a global $1 billion data center build in lots of countries, and we've already got large data centers in the U.S. in places like Plano, Texas, and we built a set of data centers in the U.S. We're building in Canada. We just opened a data center in the U.K. Germany's next. We're going to have a data center open in Germany in late spring, summer kind of time frame. The idea is, these healthcare solutions that we're bringing in the U.S., like Unified Clinical Archive, MCC in the cloud, a lot of things that we're talking about doing around electronic medical records in the cloud, we'll bring those to Germany, as we bring the data center build over here. So MCC is already here, but we'll bring the cloud version of these things as we go forward. So I think it's a pretty exciting kind of move, and we're kind of following the data center builds with these solutions.